Hey everybody, welcome to the Randy Justice Show. Tonight's show is pre-recorded as I had an engagement that I had to get to tonight. But I hope you enjoy it. Today, I'm really talking to the men out there, and we're going to talk about the prostate and the PSA test. You hear a lot about it. As a matter of fact, we just had a big drive here in town called Eddie Check. It's Eddie Kirkland died of prostate cancer, and his son Kevin started Eddie Check several years ago. They work in connection with Medic to do free PSA tests for men. The thing we're going to learn tonight is the PSA test being used the way it was supposed to? Is it something you should even have done? Now, a lot of people are going to disagree with some of the opinions that I have tonight, but I'm going to talk to you about what the National Cancer Institute says. I'm going to talk to you about what several other places say, including the Mayo Clinic, and we will go from there and talk about it, even the Prostate Cancer Foundation. So what is the PSA test? The PSA test, at best, the way everybody explains it is the PSA test is a blood test used primarily to screen for prostate cancer. So what I would say about that is that the prostate-specific antigen, or PSA, was discovered by Richard Ablin, and Richard has came out several times and said that the PSA test was never designed to be a mass screening test to test for prostate cancer. It was designed as a test for men that had already had prostate cancer to check those levels on an ongoing basis to see if the cancer had come back. So let's make this clear. It was never intended to be used as it's used today. Now, with that being said, basically what PSA is, the prostate-specific antigen, it's a protein produced by normal as well as malignant cells of the prostate gland. The PSA test measures that in the blood, like I said. And yes, it's often elevated in people who have prostate cancer, but there's times for people who have prostate cancer that it's not elevated at all. And it was, this test was originally approved by the FDA in 1986 to monitor the progression of prostate cancer in men who had already been diagnosed with the disease. In 1994, the FDA approved the PSA test to be used in conjunction with a digital rectal exam. That's where us guys know that are over 50, you get to finger up the old rear end, which, yeah, we all just love that. I know you guys listening do. And they said it was to aid in the detection of prostate cancer in men 50 years or older. And until about 2008, many doctors and professional organizations had encouraged yearly PSA screening for prostate cancer beginning at age 50. So PSA testing, along with DRE, is often used by healthcare providers for individuals who report prostate symptoms to help determine the nature of the problem. But there's a lot of things other than cancer that can raise your your PSA levels. And a lot of them are non-cancerous, very benign things. One is PSA goes up with age. The older you get, your PSA goes up. That's a fact. Inflammation can cause that, and not just inflammation in the prostate, but inflammation anywhere in the body can cause your PSA level to go up, from everything I'm reading from the experts. Inflammation in the prostate specifically. BPH, guys, you may have heard that. That's benign prostatic hyperplasia. It's where the prostate enlarges, and that happens also as we age. That can cause it to go up. And there's no evidence that either of those conditions, inflammation of the prostate or BPH, leads to prostate cancer. But somebody can have both conditions and one or both of the conditions and still get prostate cancer. I'll tell you my experience and why this interests me so much. So I had, my prostate had always been in what they consider the normal range. Most doctors say anything levels under four nanograms per milliliter and lower considered normal. But there's some individuals with PSA levels below 4 that have prostate cancer, and many with higher levels between 4 and 10 that don't have prostate cancer. So it should never be used alone, that test, to determine whether you have prostate cancer or not. The Prostate Cancer Foundation, as a matter of fact, I'm looking at their website right now, and I'll put a link to this below in the description, says basically the PSA is never meant to be a one-shot reading. It's not a consistent number or not a constant number. It's never set in stone like the 10 Commandments, straight from their website. It's more like a Polaroid snapshot, a quick capture of one moment in time. PSA fluctuates. That's why it's good to follow the general trend of the number over time, instead of just looking at one reading and saying with absolute confidence that a man definitely or does or does not have prostate cancer. Again, men that have readings as high as 10 don't have prostate cancer, a lot of them. Some that's under the 4, which is supposed to be the high end of the normal, do. So that test alone can't do it. And I don't know if you guys realize what they do, and this has been the trend for many years, that your PSA's up, it's 4 or above, and the first thing that used to be done, it's starting to change. First thing they used to do is they wanted to do a biopsy of the prostate. And it's barbaric, in my opinion, how they do this. They take a long, hollow needle, basically. They numb the area down there, and they go between your rectum and your scrotum with this long needle up into your prostate, which sits inside of you in that area, and they literally take little plugs out of it, little biopsies. And they'll take several of them. And the problem is, from everything I'm reading from all the medical establishments and everything, statistics show that when they do that, it's blind. They don't know where they're getting the tissue from. And it's only accurate at finding cancer, from statistics I'm reading, 25% of the time. So you could still have prostate cancer, and 75% of the time it could be missed. That's not very promising to me when that's such a barbaric thing. Now, a lot of doctors, and what they're starting to do is they're starting to use MRIs of the prostate first to check and see if anything looks abnormal. If it does, then there are certain urologists around the country now that will put you to sleep if a biopsy is determined to be necessary, and then they'll go in and take the biopsy, which is a whole lot more humane than the way it's been done for years. And I know there's probably some doctors that are going to hear this, and other people, they're just going to be mad at me and disagree with me. But, my thing that I've always asked, one of the things you hear about doctors all the time is, the first thing is do no harm. Well, how much damn harm is it to take that long needle and shove up there blindly trying to find cancer in something that you don't even know that there's any cancer there? I've always said there should be better tests, and that's why I'm so glad they're using the MRI now to determine whether there's really something going on or whether there's not. So some of the things, and this was from the Prostate Cancer Foundation's website, and again, I'm going to put this link below the video in the description, but there's some don'ts that they tell you right off the bat. Don't get your PSA tested if you have a urinary tract infection. It will cause the level to be elevated. Um, don't ejaculate for at least 2 days before you get the PSA test. That can raise it too. Men having an orgasm and stuff, you have sex, 48 hours before you go have a PSA test, your levels can be raised. Now, doctors done this. It's happened to me in the past. They do the digital rectal exam where you get the finger up the rear end, and most doctors do that before they ever draw your blood. The Prostate Cancer Foundation's website point blank says don't get the PSA test after your rectal exam because it can actually cause the PSA to be released in the bloodstream, which, boom, there goes the level up. So it's a false reading right off the bat. Don't work out right before your PSA test. Vigorous exercise can cause a rise in the PSA test. And especially with bicycle riding, don't go if you're a biker and you ride bicycles a lot. Don't go do that at least 48 hours before you have a PSA because that is a big culprit of raising the number. And there's a whole lot of other things. There's also some things that if you have them going on can cause a lower number than what it really is. Liver problems especially. So like I say, a lot of that is off of the cancer website, and looking at the National Cancer Institute, looking at some of the recommendations they have too, and what they say about it is the first thing it is, and we've already talked about this. They say what is a normal PSA test result, and even they say there is no specific normal or abnormal level of PSA in the blood. In the past, PSA levels of 4 nanograms per milliliter and lower were considered normal. And again, like I've already said, some individuals with PSA levels below 4 have prostate cancer, and many with higher PSA levels between 4 and 10 do not. So again, your PSA can fluctuate all over the place, and just because you have a high PSA doesn't mean you have cancer. Now, to tell you my story and what makes me so in tune to this subject is a few years ago, mine was a little over 4. Doctor panicked. Oh my gosh, we need to test. We need to do this. We think though that there's no history in your family of it. We think you have a prostate infection, so we're going to put you on antibiotics. And they put me on a very, 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 very strong antibiotic, Levaquin. I don't know if anybody's had it. Unless you are dealing with anthrax, stay the hell off of it, is how I feel. My opinion, not giving you medical advice. And none of this, let me say right off the bat, none of this information is intended to be medical advice. Please, for medical advice, seek out a qualified medical professional. Just simply my opinion based on what I've been through. So they put me on the antibiotic, and they had me on it forever because my levels stayed up. Well, as we've already found out, there's a lot of things that can keep your levels up, and there are men that have levels as high as 10, and they don't have problems, symptoms, or anything else. So what happened with Levaquin, and there's doctors say this couldn't happen, but yes, it has. An ER doctor told me that I was not the first person he'd seen this happen with. I ended up thinking I was having a heart attack. I had shooting pains down my left arm. It was going numb. I had horrible chest pains and back pains and tightness in my jaw, and thought I was having a heart attack. Went in. All my heart markers, all the blood work, every test they did on my heart was perfect. So then they started questioning me. What are you taking? What are you doing? And the minute I told him I was on Levaquin and why, he said, stop taking it immediately. He said, you're not the first one that's come in the ER that thought they were having a heart attack with the same symptoms that was taking that drug. So them trying to cure an infection I never had in the first place, they put me in a panic mode thinking I was having a heart attack, and there's the psychological thing. What does that do to you? You know, you think you're having a heart attack, so now, oh my God, I got to get to the hospital. So you're calling ambulances, you're doing all this stuff. You get poked, prodded, and everything else. Huge needles shoved in your arm in case they have to transfer blood or do all these things or do surgery on you and put you through pure hell over something that could have been avoided in the first place. So needless to say, I didn't have prostate cancer and still don't. Finally, I met a doctor that sent me for an MRI. The MRI showed that, yes, my prostate was a little enlarged because I'm older, but there was no other abnormalities in it. Had we done that in the first place, I wouldn't have been put through the hell and thought I was going to die of a heart attack. And that's the thing too, man. You get put in that situation where you're in that kind of pain and you have all the typical heart attack symptoms. What does that do for the stress put on your heart? What does that do? Raises your blood pressure, raises your heart rate. What if you end up stroking out because they caused a situation that panicked you into that point? Because panic was where I was at. My wife, Deb, who some of you all know, she's been on the show and been with me on several things. It's like she said, when I was saying I've got to go to the ER, she knew something was wrong because I'm not that guy. I don't run to the ER unless I am dying. It's not me. But we got off the Levaquin, and it literally took me 2 years to get over all the symptoms from taking that drug. And I wish it had never happened. And that's when I made the decision to change doctors. Because, when you try to kill me thinking I have something that I don't even have, and you don't do, in my opinion, the proper test, it's time to make a change. There was a statistic I read a while back that said people who argue with their doctors live longer, because doctors are human too. I don't care how much school or what they had, and there's some fantastic medical professionals out there, but they don't know everything. And all they know is what they've been taught. And unfortunately, most of them who are in the allopathic medicine, which is your traditional, what we call healthcare in this country, I call it sick care, they're taught to diagnose, prescribe drugs, cut, burn, and poison people well. I've said that before. Again, these are my opinions. And that model is keeping people sick. It's not getting anybody well. They treat the symptoms instead of finding what's the root cause for things. So let's find out, what's the root cause of my PSA? Okay, it was 4. That's not unnormal, because do you want to know how they come up with those numbers that they set from 0 to 4 being normal? Because that's what somebody put on a piece of paper in a damn lab. Again, we've already heard, I'm looking again at the Cancer Institute's website, cancer.gov. Men between 4 and 10 don't have prostate cancer at times. They could have, but a lot of them don't. And men under 4 don't. And again, we've already found out that PSA fluctuates over age. So a lot of things, like I say, if you decide to have one, I've decided never to have another PSA test ever. It's just not going to happen for me. Apologize getting a text I need to answer, because I am at work right now recording this early, like I said, since I could not be live tonight. One thing that happens when people have high levels of PSA, a lot of doctors overtreat. There's a lot of people diagnosed with prostate cancer that never had it in the first place. And they don't find that until they do a biopsy, or until they actually end up having surgery to have their prostate removed. And then they find out, oh crap, we made a mistake. There was no cancer in the first place. So, talking about the PSA test and false positive results, and that's what I had, false positive test results when PSA level is elevated, but no cancer is actually present. And what they say is a false positive test, which is what happened to me, result may cause anxiety and lead to additional medical procedures such as prostate biopsy that can be harmful. And we've not talked about that. So I've told you where they have to go to get the biopsy done. So the possible side effects of that, and this happens all the time. I talked to a lady that actually works in a urologist office, and they see this constantly. There's serious infections can happen, pain and bleeding, and you end up in the ER after you've had one of those things. Um, Again, talking about false positive results, I went over this earlier. Um, Only about 25% of the people who have a prostate biopsy due to an elevated PSA are found to have prostate cancer when a biopsy is done. So, I guess in conclusion, I'm gonna put links to all this so you guys can read it, make up your own mind, make an informed choice. But again, myself personal, and please don't go based off of what I'm saying. This isn't medical advice. Seek proper medical advice. From your doctor or from a qualified urologist or somebody that really knows what they're doing. But do your homework and find somebody that does MRIs to check the prostate. Find somebody that doesn't just rely on the PSA. Find somebody that doesn't follow what they call the tried and true diagnosis method, because you can put yourself in a lot of harm and go through pure hell, which is what I went through. I've made the decision, because of the stress it can put on you, that I'm just not going to have it. I've talked to several doctors, and what I have found too is the most common form of prostate cancer that men have. I have read in several places that you'll die of old age or something else before you ever have a symptom from it. And if it's the very aggressive kind of prostate cancer, you're probably, by the time it's detected, you're probably not in a good position to fight it. And at best, if it's treated at that point, if it's found early enough, you'll have from what I've read, again, please do the research yourself, about a 10-year survival rate. So I don't know. Let me know your thoughts in the comments below. What do you think? Should you have a PSA? Do you get one if you're a guy listening to this? Again, I'll never get another one. It's not going to happen. I'm 58 years old. Guess what? I've lived a good life. It's just, and it is not worth it to me to put myself through that hell again, based on a slightly elevated PSA level. And I've talked to a lot of doctors that don't even, unless a patient asks for the test, they just don't do it anymore, because they were finding that there were too many false positives, and it was causing people a lot of discomfort, a lot of anxiety, and just a lot of problems. So again, that's why I want to talk about this today. I've talked to several guys now that I'm getting older. I know a lot of people are in the same boat, and their doctors constantly tell you, "Gotta get the PSA. It's raised. We got to watch that, or we got to do this." So I guess what I want to come away with from this is the fact that just because your PSA level's raised doesn't mean you have prostate cancer. You can have prostate cancer and the levels be totally what they consider normal. You can have a high PSA and not have cancer at all. That's why I believe, and this is strictly my opinion, again, I'm not a doctor, not trying to give you medical advice. I think the MRI to detect any changes in the prostate, what does it look like, is one of the best tests out there. Like I say, I have one, and mine was totally fine. Anyway, guys, that's the show for today. I hope that you have learned something. Again, you'll find links to the articles and stuff that I've read below. Check them out for yourself. Do your own research. I hope you've enjoyed it. Give a quick shout out. My favorite doctors in Knoxville, Embody Healthcare, Dr. Mike Major and Melissa Major, nurse practitioner. They are the owners of Embody Healthcare, and they have done so much to help us. As a matter of fact, I'll tell you, they're direct primary care practice, which means that for a monthly membership fee, it's really low. It's $99 for individuals. If you're a business such as we are, we have about half of our employees now that go to them. It's $75 a month for employers to send their employees. We split that cost for their employees, so we don't take on all the burden, and neither do they. But what we're finding and what's great about it is 98% of all your medical needs can be taken care of for that membership. You don't have to go through insurance. There's no copays. There's none of that you have to deal with. And as a matter of fact, our operations manager, Charlie, last Friday night, has an earring. I make fun of him all the time, but it's cool. He's got an earring, nothing wrong with that. But his dog got a hold of it and ripped it out of his ear, split his ear completely open. Now, Charlie needs stitches. If he had had to go to the ER, you're talking about they would have billed the insurance company, who knows, $2,500, $3,000. He would have probably had $800 or so out of his pocket. And if he hadn't made his deductible, guess who's paying that? Not the insurance company, but Charlie would be paying that. Instead, and I do have his permission to talk about this, but instead, he went on we have an app with Embody Healthcare where we can send them a private message, HIPAA compliant, and Mike asked Charlie to send him a picture of it, told him, told him to be at the office next morning at 10:30. Mike sewed it up right there in the office, no additional cost. That was all included in the monthly membership fee. So how much value did that bring right there? Instead of that $2,500, $3,000 ER visit and the time you'd spend in the waiting room and everything else, Charlie was in and out in 30 minutes, and didn't cost any more than $75 a month membership fee for him to be a patient at Embody Healthcare. So check them out, mbodyhealthcare.com. You can see it up in the corner of the screen. That's the letter M, bodyhealthcare.com. Put a plug in for our business because that's how I make money and stay here. Knox Horizon Complete Auto Care. We're a Napa Auto Care Center. We do everything auto repair related, everything from basic oil changes, tire rotations, to brakes, to transmissions, to engines, and everything in between. Check us out, knoxhorizon.com. We're having our Customer Appreciation Days coming up. September 26th and September 27th. We're going to serve lunch both days from 11:30 to 2:30. We're going to have the Napa NASCAR Craftsman truck here. News Talk Radio is going to be broadcasting. WIMZ 103.5 Classic Rock is going to be here broadcasting. And we're going to have some giveaways and a whole lot more. For everybody that comes out that day and needs an oil change, we're giving 15% off both days to everybody that gets oil change, tire rotation. So come on out and see us the 26th, 27th. I'll leave a link below to our website, one for Embody and one to all the information that we talked about today, including some great websites to visit on PSA. Anyway, thank you guys. I hope you've enjoyed the show. Leave your comments below. And I can't wait and hope to see you next week live, and we'll talk then.